insightful journey ahead. And we have a very packed and dynamic program ahead in this session designed to explore the critical interplay between the urban water management and human well-being. Our session promises to unravel some new perspectives, innovation, including solutions, and actionable insights that can shape the future of the sustainable water practices. And here, to kick off our program, please join me in welcoming Professor Kensuke Fukushi, the Academic Program Advisor at UNUIS and the Director of the Institute for Future Initiatives at the University of Tokyo. He will set up the stage for our further discussions and offer a knowledge into the significance of today's topic. So, Professor Fukushi, the floor is yours.
Thank you very much, Dr. Pu. Welcome, everybody. There's the session, Sustainable Urban Water for Human Health and Well-being, organized by the United Nations University Institute for the Advanced Study of Sustainability, or UNUIS. My name is Ken Fukushi. As indicated in the title, the session aims to explore the role of water for better well-being, especially healthy aspects. The session starts by 2 keynote speeches, followed by flash 3-minute presentation. We have many presentations of United Nations University institutions and our partner universities. Presentation include various case studies, and I'm sure that they inspire all audiences. Definition of human well-being is difficult. The reason is that the various factors determine the well-being, different age, different region, different gender, and it changes according to the time. I want you to think and discuss in the session, what is the true value of water? We have quite unique structure of the panel discussion. Through this presentation, we are requesting to all participants to answer questions that will be asked through the chat box. So unlike other lecture, we expect to watch chat box carefully during flash panel presentation. So without delay, I will return microphone to the Dr. Puja.
Okay, thank you very much, Professor Fukushi, for the unique perspective to our session and future discussions. And now let's move on forward to the heart of our session, where 2 keynote speakers will share their insights. We will begin with a keynote speech that promises to connect the urban water, health, and human well-being. I would like to welcome the talk from Professor Tony Capron, the Director of Monash Sustainable Development Institute at Monash University. So I will share the screen now.
Thanks for the opportunity to speak with you today about urban water, planetary health, and human well-being. In this talk, I'd like to do 3 things. First, refer to the Rockefeller Foundation Lancet Commission on Planetary Health. Second, explore the value of human ecology as a way of understanding patterns of health and well-being. And finally, share with you the approach we're taking at Monash University with our RISE program, revitalizing informal settlements and their environments. In 2014, the editor-in-chief of the Lancet Medical Journal, Richard Horton, convened a commission on planetary health with support from the Rockefeller Foundation. What is planetary health? Put simply, planetary health is the health of human civilization and the state of the natural systems on which it depends. What did we find in the commission? By almost any measure, the human population is healthier now than ever before. Here, World Bank data, life expectancy, a key measure of health. On the left, 1960, on the right through to 2010. And the black line in the middle of the chart showing that life expectancy during this period rose from the low 50s through the high 60s, it's now into the low 70s. And those colored lines on the chart, the World Bank regions, and you can see that health by this measure has been rising across all of the World Bank regions, but clearly inequitably. Still significant deficits in life expectancy for people in Africa, South Central, and West Asia. But in achieving those health gains, we've exploited the planet at an unprecedented rate. Escalating carbon dioxide emissions, ocean acidification, energy use, global deforestation, water use, fertilizer use. This is what earth scientists call the great acceleration in consumption. And of course, human population from 1950 here, projected through to 2030 based on UN estimates. And you can see the purple bars showing a seemingly inexorable increase in total human population of the world through this period. And the lines on the chart, the blue line, the number of people living in rural areas, the red line, number of people living in cities. And as you well know, as participants in this important meeting today, that most future population growth will be in cities. And indeed, we're adding about 1 million people a week to urban populations around the world. This is a big challenge, but also an opportunity. In planetary health, we bring human ecology alongside epidemiology to understand patterns of health and well-being. Here, I refer to the work of Stephen Boyden, very eminent human ecologist, and one of his books here on the right, The Biology of Civilization, Understanding Human Culture as a Force in Nature. In human ecology, we understand that all human activities, everything we're doing every day on Earth, either individually or collectively, has potential for positive or negative impacts on our health. We refer to behavioral risk factors. We explore social determinants of health. But in health research, we don't pay as much attention to the way human activities are affecting the health of the planet. Climate, biodiversity, ecosystems. These are critical, though, because we now understand that climate change has significant health effects. Biodiversity loss has important health effects. Ecosystem degradation has health effects. We call these ecological determinants of health. And the final slide in this sequence has the arrows in the opposite direction, reminding us to think in systems and understand the potential for unintended consequences from the interventions we might make. This is Boyden's biosensitivity triangle from the work of Stephen Boyden, and there's a link to where you can download further information about this approach. In the work I do, looking at the implications of urban policy, planning, design, development, and management for human activities, how the way we do things in cities will shape human activities, and what that means for the health of people and the planet. Here's a link to the Lancet Commission on Planetary Health. There's a 50-page report, and there's other pieces of writing. There's infographics and video material on that site too. At Monash University, one of our major programs is called RISE, Revitalizing Informal Settlements and Their Environments. Today, more than 1 billion people live in urban informal settlements. More than 2 billion people around the world lack adequate sanitation. More than 500,000 children under the age of 5 die of diarrheal disease every year. With the RISE program, our vision is to improve human, environmental, and ecological health in informal urban settlements across the developing world through a novel approach to water management. Conventional approaches to water and sanitation are not always fit for purpose in urban informal settlements. You'll see here on the left, trunk infrastructure. On the right, the WASH approach, water, sanitation and hygiene. Our work is about the missing middle. The water-sensitive approach aims to achieve multiple co-benefits in informal settlements using nature-based solutions. Protecting from flooding hazards, improving public health through sanitation, improving environmental quality, stormwater harvesting and wastewater recycling, alternative water supplies, and effective use of floodplains. Through RISE, we're trialling innovative and sustainable water and sanitation solutions in 24 informal settlements in Fiji and Indonesia. RISE is a partnership of 25 industry, academic, community, and government partners. You can see here some of our key partners across the region. So what? 5 key messages. We need an eco-social approach, recognizing ecological, economic, and social determinants of health. Systems thinking is important, acknowledging feedback, unintended consequences, and policy resistance. A focus on intergenerational health equity, thinking about legacy, thinking multiple generations ahead, as point 4, Indigenous communities do. We need to value Indigenous knowledge, local knowledge, and take a transdisciplinary approach, transcending academic disciplines, valuing the academic expertise, and also valuing Indigenous and local knowledge, transcending these different knowledge systems. And the final point, a summative point, we need to bring planetary consciousness to our urban water research, education, policy, and practice. Thanks very much.
So we finished hearing the keynote 1. And our exploration continues with another keynote speech, who is now serving as associate professor at University of Tokyo. And Dr. Kumiko Oguma will shed light on the challenges that lie ahead for sustainable urban water system. Please join me in welcome the talk from her. I will share the screen.
Tokyo, Japan. It's my great honor to give my talk today, and the title is Challenges for Sustainable Urban Water Systems. So let me clarify the well-known facts on water for health and well-being. Water for drinking, of course, we need it, and 2 billion gained access to safe drinking water, while 2 billion remains not. So unfortunately, the world is not even close to being on track to meet the SDGs by the target year 2030. What about the water for cooking? Health risk associated with cooking water is sometimes neglected, but it's not always negligible. For example, the rice soaked in fluoride-containing water can accumulate fluoride in high level. What about the water for hygiene and healthcare? Unfortunately, 3 billion do not have a hand washing facility with water and soap at home, and 2 billion depend on healthcare facilities without basic water services. What about the water for agriculture and industries? Both agriculture and industries definitely need a large amount of water, and agriculture accounts for 70% of global water withdrawal. industries need water-efficient systems, such as water reuse or water use in cascade, which means change the water use depending on the water quality. What about the cities and the communities? Yes, we need the water in cities for daily life. And strategic water storage and drainage are very important based on the fact that 90% of natural disasters nowadays are climate related, like floods and droughts. So the integrated water resources management, or IWRM, is very important and to be further promoted. So as one of the part of the IWRM, technologies including desalination, wastewater reclamation, and reuse play key roles to better manage water resources. So this is a quality change in the use of water along with time and the water quality here on the y-axis. So let's think of the unpolluted water as a source water for drinking purposes. We do some water treatment, and then the water will get to the higher quality, which is drinking water. When we use it for the municipal and industrial purposes, then the water quality gets low, and we're going to get the wastewater, which is at the lower quality of the original source water. Then we are going to do the conventional wastewater treatment to make the water as a treated effluent, and this is discharged to the natural water environment. And then if we do wastewater reclamation, we can get the reclaimed water almost at the same or equivalent water quality as the natural source water. Then we can possibly use this for non-potable purposes. And then if we do further intensive treatment of water reclamation, we can get the reclaimed water, which has the equivalent water quality to drinking water. Then this can be used as a potable water reuse. So in a science and technology basis, those things are all related to science and technologies. Of course, we need technologies for treatment purposes, and also we need science to monitor and understand how the water quality changes, gets worse or gets better, along with the use and treatment. So this is how science and technologies are needed for the better water management. So the wastewater reuse is not really very rare cases anymore in the world. For example, in the States, in the United States, the water reuse regulations or guidelines are already installed in those blue-colored states. So for non-potable purposes, many already have the rules, and even for the potable reuse, those states already have the regulations or guidelines, which means the potable reuse is not really rare anymore. That could be a practical option nowadays. So those highly intensive treatment or large-scale systems would work for the very urbanized areas with high population density. But what about the options for small communities in rural or remote locations? I would say that traditional infrastructures requiring large constructions may not be the best fit solution in the cost and energy or CO2 viewpoints. So instead, the decentralized and small water systems can better fit in community-level water supply and management systems. Those photos are the examples of community-based water supplies in Sri Lanka, Canada, and Japan. You may think that the small systems are only in less developed countries, but that is not really true. Even in countries like Canada and Japan, we definitely need and rely on those community-based water systems where the public large-scale water supply is not accessible, and then people do some decentralized systems for water treatment and supply. So let me clarify the concept of the centralized versus decentralized water systems. What's called centralized system is a very traditional or conventional water supply network where the treatment is all done in a centralized manner at the water treatment plant, and then this will be distributed through the pipe network to the customers. On the other hand, what's called decentralized systems include those small-scale systems. The community water supply is what I showed in the previous slide. So they get the source water locally, and then they do the treatment within the community and share the water within the community residents. This is typical type of community water supply. And when it goes to the smaller scale, we also know the system called the point of entry or POE, where the water is treated at the point of entry into the buildings. And if we go even much smaller scale, we have the POU, point of use systems, which treat water at the point of use, which basically means tap. So the point is, centralized systems only would never meet the SDGs by the target year 2030. We cannot make it in time, apparently. So in that context, the decentralized systems play key roles as one of the basic needs for society. And it's not just a private consumer product, I would say, but it's more like a social infrastructure. Yeah, so this is my understanding. And the real question is not to discuss which is better, but to think of how to achieve the best mixture in a win-win manner of centralized and decentralized systems. So this is my final remarks. Water for human health and well-being is facing multiple challenges, which may be intensified by the climate change, very unfortunately. And water technologies are playing roles to improve water resources in both quantity and quality. As I mentioned, like wastewater reuse, we can improve the resources in both quantity and quality. And then the small and the decentralized water systems would play key roles to achieve SDGs in time. And finally, although I did not really mention this factor during my main presentation, let me stress and mention this at the end. As a person in engineering, I always feel like technology only would not overcome the challenges. So the interdisciplinary and multi-sectoral approach are really inevitable for the better future water management. Okay, that's all from me, and thank you for your kind attention.
Yeah, as we observe these enlightening keynote speeches, I think it's time to move on to the next. And before the next session, now to maybe for the event, I would like to ask all of you to turn on the cameras. Let's take a group photo. And meanwhile, let's invite our panel session moderator, Dr. Fukushi.
Yes. The panel, I think we have 10 seconds to turn on the camera. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take photo. Okay. There we have, as we explore, I mean, in the program, we have 7 presentations from the various, case studies actually from the UNU institution mainly. There, during the session, the question that we prepared from our early career researcher and the student is going to be posted in their chat box. So I would expect all audiences to react and read and react, according to the direction, which is given in their chat box. it's kind of busy session because you have to listen their presentation and then you have to make some reaction in their chat box, and then the result of this, I mean, this question, I mean, there is going to be summarized at the end of the panel session. So let me introduce first speaker of this panel. The first speaker is Dr. Martin Powell Jarzewski from United Nations University Institute IAS. The Water for our Sustainable Society Indicator-Based Evaluation System. Martin, you can take over the microphone. Martin, unmute.
Sorry. Thank you very much, Ken, for the introduction. So my name is Marcin Jarzewski, and I'm a research fellow and academic associate at UNUIES. And I would like to briefly introduce how our work in our institute is relevant to today's discussion on human health and well-being. So water plays a significant role in transforming our urban food, energy, and socioeconomic system. And we improve urban water quality and quantity. If we improve it, we enhance, of course, our blue-green infrastructure, conserve our aquatic ecosystem, support our groundwater recharge, and even contribute to mitigation of urban heat island and natural disasters such as flood. So these efforts are necessary and essential, of course, to achieve sustainable development goals and for broader sustainability transitions. So to understand the importance of water, that we must recognize these different interconnections of especially three pillars like economy, human, environment. And these three elements from the foundation of sustainable regional development are essential, ensuring prosperity and well-being of our society and providing the even better quality of life. So, of course, next slide. If we talk about the water quality, which is not good yet, maybe we often have in mind still countries which are on the still developing countries, which have a quite extensive industrialization ongoing. But, not only those countries have water quality, even in the past, like Japan and including Tokyo, witnessed quite a bad situation of the water quality. The water went through the degradation through the industrialization of the country. The example is River of Tokyo. And you can see that COD in 1960s, 70s was really bad. But over the time, we witnessed quite good improvement. And of course, this is related to the policy improvement. But not only, we need to be aware that there are many other factors that has contributed to this significant water quality improvement. So, in the next slide. So we want to allow this quick shift from the quite still not the good quality of water into a much better quality of water. And that is what is our work about, including the indicator system that we are working on. And this work is on the way, but these indicators include socioeconomic, environmental, and governance factors, offering water and offering a tool that could be used by the governments and policy makers in order to design policies that specifically in each country will be supportive and accelerating water quality improvement. So in conclusion, the water is not merely a resource, it's also our lifeline. So by striking a balance between development and sustainability, of course, we can build resilient communities, which will provide a environment for a quite good life quality and our well-being and good health of our population. Thank you so much.
Thank you, Martin. We'd like to invite Dr. Professor Kita Mohan with Tromsø University, presenting the empowering health and indigenous communities, the transformation of the impact of the gravity-fed water supply system. Kita, floor is yours.
Thank you very much, Fukushi Sensei. Hello, everyone. My topic, as Fukushi Sensei mentioned, I'm going to talk about how empowering health and indigenous communities using the gravity-fed water supply systems in India. So before starting what exactly the gravity-fed water system supply systems, I would like to look deliver what is the current situation of the Indian context of the SDG indices like 3 and 6. So next slide, please. I just want to. Yeah. So if you look at the map of India, SDG 3 and SDG 6. So this is actually the study location is located in Andhra Pradesh, which is in the southern part of India, the down. And if you look at the SDG 3, the human health, the rate of Andhra Pradesh is actually 68%. And if you look at the SDG 6 situation, the performance situation in the southern part of India, which accounts 59%. So which means that so there is a lot of room actually to need to be improved, and there is a lot of contribution to do for SDG 3 and SDG 6. So however, actually there are so many tribal villages located in India, which the tribal people who are lives in hilly areas, they have a lack of unprotected. So they have actually unprotected water resources, which actually leads to illness and diseases. So if you look at the account, like 8.6% of total population actually lives in India as a country-wise. And in case of the state of Andhra Pradesh, so there are 5.5% of the total population actually is contributed for the tribal people, tribal communities. So as I mentioned, like approximately 50 to 70% of the tribal villages in these areas lack of access to clean and safe drinking water. So next slide, please. So these are the few examples which has done by one of the agencies in southern part of India, as I mentioned. So they try to actually improve the water quality to easy access for these tribal people. So if you look at the left-hand side, there is a gravity water fed water supply systems, which one of the previous keynote speaker also mentioned that there is a decentralized system, which is very helpful for the rural people. So this system actually is quite very useful, and actually it can be provide 24 hours and 365 days continuous good quality of drinking water. So if you look at the before implementing this gravity fed water supply system, so they have a different types of illness versus drinking water. If you look at the first figure, which is actually towards like illness versus the stream water and well water. So in case of the stream water, like scabies and malaria and diarrhea, cholera, vomiting, and cold and cough, these are the major illness actually has been happened in these tribal villages. So if you look at the water situation in tribal communities after implementing this gravity water fed system, so still they have, these communities like 1561 communities still secure using this gravity based water fed systems, followed by the water security like open head tanks and water secured solar system and water secured bore wells. So as I mentioned, after implementing this gravity water fed system, so could you please go to the next slide, please? Yeah. So after implementing this, actually they collect the water from the springs, which is available from the mountains, and they actually connect directly to the pipes to the the small tank. The small tank contains like filters, so that actually it will be filter and actually provide the pure drinking water. So that is actually very benefit for these tribal villages. So not only that, actually after implementing this kind of a small technologies, actually they save like a lot of time saving, and also actually save drinking water availability by 24/7 into 365 days. And more importantly, actually women can actually spend more time not only for carrying water, even actually she can actually divert and also contribute for economic activities such as an agriculture fields or non-farm activities. And most important thing is actually the girl childs always help mother to carry water. So implementing this kind of a technology, actually, they can actually go for school and reduce the dropout children. And finally, actually, they can improve the personal, hygiene practices. So yeah, thank you very much. So yeah.
Thank you, Dr. Gita. A third presentation is by Dr. Daniel Kalte from UNU Florest on the vector control, integrating a neglected aspect into urban water management. Floor is yours, Daniel.
Thank you very much, Marcin, for the introduction. So I'm speaking about, do I need to share my screen? Because this one doesn't advance.
Is sharing, do you want to turn on your video as well?
Yeah. So in case of vector-borne diseases, we speak about a problem that is happening each and every day, and not something like a catastrophic flood that is maybe occurring once every 100 years. This is something that is happening tonight, and vector-borne diseases cause about 2,000 deaths per day, including today, and 700,000 per year. When we look at climate change and urbanization, these are two of the key drivers of changing the incidence of vector-borne diseases in the future. And the decline in malaria is happening, but at the same time, we see that it is transforming from a rural to an increasingly urban disease. While at the same time, some viral mosquito-borne diseases like dengue or Zika virus are increasing in urban areas. So when we look at future trends of vector-borne diseases, firstly, we need to look at climate change, and each specific disease has its climate optimum. So for example, the tropical malaria caused by Plasmodium falciparum and the Anopheles gambiae, mostly mosquitoes, has an optimum of about 26 degrees, whereas, for example, the Zika virus and dengue virus infections transmitted by the Aedes aegypti mosquitoes have about 29 degrees as the thermal optimum. And this means that in some parts of the world, the increase in temperatures will mean that different diseases will become prevalent. At the same time, urbanization plays an important role. And these are pictures from World Health Organization and UN Habitat that show in a schematic way how the development of cities can change the pattern of vector-borne disease transmission. In immature cities, typically vector-borne diseases are transmitted somewhere in the urban fringes, but there is then a zone inside the city where the situation is getting better. When we then look into maturing cities, there are regions where there is no transmission, but also increasingly large regions where there is transmission. And then when we ultimately look at mature cities, there is a different pattern where large parts of the city ideally would have no transmission. So let us look now at ways of integrating vector control into urban water management. When we look at SDG 6, vector control is not included, and it's not a part of most urban water management strategies. But when we look at what is happening, dengue, for example, this is an article from the Manila Times from the Philippines from last year. Dengue cases rise by 58% as compared to the previous year. This really shows us that this is a serious problem, which is addressed by SDG target 3.3, fight communicable diseases, but typically it's done in the way that insecticides are sprayed somewhere in the city. Now, ideally, the solution would be integrated into urban water management, and that means managing urban and peri-urban agriculture, because these are the places that constitute breeding sites for the vectors that transmit diseases. There is urban drainage, which needs to be controlled, and in the end, also microhabitats, because sometimes very small habitats can be the places where the transmitting mosquitoes breed. Thank you very much for your attention.
Thank you, Daniel. We'd like to shift to our fourth speaker. She's Nidhi Nagabuhatra from UNU-CRIS in the innovative strategy for the urban water security, a game changer approach. Nidhi, please start.
Thank you, Ken, and hello everyone from different parts of the world joining us today for this session. I'm going to be talking very briefly about many innovative strategies that are now positioned to steer urban water security. The game changer approach was the concept that we all heard during the UN Water Conference in the early part of the year, March 2023. And to take that ahead, the work that we are doing at UNU-CRIS, along with several other UNU agencies, national and international partners. Next slide, please. On the screen, you can also see that there are financial institutions like World Bank, but also the research and media discourses that is now positioning circular economy as one of the innovative solutions to steer the urban water security discourse. Why is this even necessary? Why should we put one more elephant in the room? Because circularity is showing potential, especially in the terms of water quality management, to water quantity or availability management, to looking beyond the provisioning services like water, drinking water, and sanitation needs. And when you talk about this sector, human well-being is pretty much embedded in that discourse, because water quality has a direct impact on human well-being. When you look at this map, and I'm going to just summarize it for you, all the red colors that you see on the map are countries that are either treating half or less than half of their wastewater before it flows into national systems. The ecosystems that give us the provisioning and other services, cultural services, provisioning services, and maintains our environmental flows. So we've been working to develop transformative pathways to look beyond the reuse water normative thinking that has been a part of the urban water management for long years. And in terms of key dimensions, some of our recent synthesis work, assessment work has given 4 key dimensions to position circularity in the water sector. One is foresight planning, so developing wastewater initiatives as a part of the basin framework. So not just as a municipal supply framework, but larger the basin framework, and it could be involving many countries if you share your water resources across borders. Realizing the wastewater value and making wastewater an accepted norm in several sectors, industry, agriculture, and other production and consumption uses and streams. Innovation embraced. So to be able to do that, innovation has a big role to play in this, embracing of innovations as a game, if we have to position that as a game-changing approach. So talking to that point, and of course, we all know policy, without the policy support system, support at the subnational, national, regional, and global level, we won't be able to take this transformative pathway into execution. Next slide, please. The UN family is also doing an important role in putting out frameworks. I encourage you to look at the UNEP circularity framework. And this framework at least is a guiding principle to use circularity in the water sector, which is still an emerging narrative, emerging discourse, both in terms of research and implementation. The circular economy action plan, the European Green Deal, is one milestone in that direction. And so is the Global Alliance on Circular Economy and Resource Use Efficiency, steered by the European Commission, putting together Global North and Global South in one global platform to be able to execute this strategy. Closing slide, please. And the private sector is also a part of the game. So this is one key highlight, a take-home message that I'd like to give to our audience today. The World Business Council for Sustainable Development has already brought a number of private sectors on board. They have a circular transition indicator series. Please have a look. But in terms for the water scientists who are joining us today, they also have a conceptual framework and implementation strategy on how businesses, along with private-public partnerships or some other modalities that can bring public and the private sector together, can embrace this game-changer approach collectively. Thank you.
Thank you, Nidhi. Our next speaker is Sanae Okamoto from UNU Merit and cross-generation impact in climate change-related water insecurities on the psychological development of future generations. Sanae, you can take the floor.
Thank you. Thank you very much, Fukui-sensei. I'm Sanae Okamoto, researcher at the UNU Merit with a background in psychology and behavioral science. I'd like to share some insights about how climate change induced water and water insecurities that the children and the younger generation face could impact their psychological development throughout the life cycles. Next slide, please. Taking care of mental health is not trivial, as it affects not only how we feel, but also how we handle stress, and also how we relate to others to build a healthy community, and how we make right choices and life decisions. There are about 1 billion people worldwide suffering from mental illness, yet mental health care support from public services is very often inadequate or missing. The situation is especially worse in the area where the basic health support system is lacking, or where mental health illness is considered as a cultural taboos or personal weakness. So if you look at the situation for children, mental health care support is almost non-existing. Even in high-income countries, most children with psychological problems receive almost no or very little support. But around 85% of the world's children live in low and middle-income countries that are actually most vulnerable to climate risks, despite being least responsible for causing it, but least empowered to participate in its solution. However, still very little attention has been given about mental health consequences of climate risks for children, especially women and girls are often largely affected by poor access to water, wash services, and it can take a huge toll on their mental health. So the left side, the developmental perspectives of mental health is based on the observation that most mental disorders begin early in life, that the disorders are the consequences of genetic and psychosocial environmental factors that can be seen in this ecological nesting system. The timing and severity and the duration of early life stressors can have lifelong effects on psychological health and well-being. So next slide, please. When we look at it chronologically, from the time of conception, we are exposed to the climate risks. For instance, if a mother is under the water and the wash insecurities related to physical and psychological burdens, the stress causes physiological changes in their response, the stress response system, and affects the fetus development. And then such negative impacts continue to early middle childhood and to young adulthood. If the situation doesn't improve, while they become parents, the same cycle continues. It's a cascading effect of long-term cross-generational impacts, and it will impact the community's health as well. The next slide, please. Therefore, we need swift and effective action to reduce this burden of intergenerational injustice of water and wash insecurities. For instance, we need more evidence to enhance understanding of long-term impacts on children. Cultural taboos and stigma around the mental health-related issues need to be resolved, and also water and wash situation in living areas also need to be improved. And we also need to harness family and community support by empowering the younger population to participate in climate and water discourse, or like they get more opportunities in like some advocating in events and opportunities as well. The healthy psychological development is essential as it fosters the society's future social, economic, and human capital. Thank you very much.
Thank you, Sanae. Unfortunately, we are not really finding Dr. Lina Tang. So we'd like to skip her presentation and go directly to Dr. Simone Sandhol's presentation. Simone, are you ready?
I am.
Okay, very good. Her presentation is they're ensuring emergency water supply for the healthcare. She's from UNU EHS. Simone, can start.
Thank you so much for the introduction. Jianpu, I think you started slide 26, please. Awesome. Many thanks. And yeah, thanks for the kind introduction. So we've heard a lot already around water supplies, and water supply itself is considered a critical infrastructure in many national legislations. And because it is necessary for health and well-being. Yes, exactly that now. Thank you so much. But a functioning supply would also have a lot of not only direct impacts on people and their health and well-being, it would also have indirect impacts because it implies and it might disrupt the functioning of other critical infrastructures, just like healthcare. So unfortunately, such interdependencies are not always planned for in disaster preparedness or considered in reconstruction to prepare for future events. And that would definitely have to be addressed given the growing number and also growing impacts of disasters like flood events. And that would be the case for all kinds of cities and countries, both high income but also low and middle income countries, as you can see in these two examples that happened just 2 years ago in Indonesia, but then also in the West Sulawesi earthquake or in the German floods, Central European flood event, which actually has been the most disastrous event in Europe, in Germany ever. And among others, at least in the case of Germany, it resulted in the evacuation of 2 hospitals located in flood-prone areas. And as you can see, the left actually is the entrance door of that hospital. And if you could move to the next slide, please. So since a couple of years, my colleagues and I are doing research under the No Water Project, and that aims at analyzing emergency preparedness planning for water supply and sanitation in healthcare facilities. And we look at both organizational and technical solutions to look at resilience. And one key finding is actually this framework, which is based on 30+ interviews and surveys with healthcare facilities, but also infrastructure providers, first responders in Germany, but also in the EU and worldwide, including a large number of interviews also with people and actors affected by these flood events to understand how do these critical infrastructures work and where's the blind spot? And that actually seems to be the case by not necessarily understanding these healthcare facilities or as a critical infrastructure, which is composed of both social and technical subcomponents. And that actually would have to change because just the technological perspective will not save us enough. So that's why this left side of the system, which I want to point you at, the social part, is the most crucial one because it's very often not necessarily considered. So looking at the actors, their awareness, like hospital staff, how they would need to build networks to other critical actors, the trainings they need, the plans to prepare, but also efficiently act during a crisis. And lastly, also guide innovation and investments in these healthcare facilities like hospitals into considering these social components and not only the technical one, as the best technical solution will definitely fail if the social infrastructure, if staff and their capabilities are not up to the challenge. And the last slide in my presentation actually then points at these very critical questions. How around the probability of outages, the duration, how long hospitals could sustain themselves, and what conclusions would have to be drawn from that for improving preparedness and how far both technical and social components are considered in that. Many thanks.
Thank you very much, Simone. This is the end of the panel session, and I expect you already answered the 3 questions that they raised in their chat box. And I will return microphone to the MC, Dr. Poo.
Yes, thank you so much, Dr. Fukushi, for hosting this panel discussion session. And let's welcome our Young Korea group to introduce the results from their parallel interactive session. So Alex, are you ready to share the screen?
Yeah, hello everyone. I'm Fritjof Schulz-Floray, and I'm speaking in behalf of a group of early career scientists and young students from UNU CRIS, UNU Flores, UNU IAS, and UNU EHS. And yeah, we were given the opportunity to ask a few questions during the sessions. And first of all, thank you to all the speakers for your interesting talks. And especially thank you to the audience for engaging in answering these questions. So in regards of the first question, most people answered that there are always regulations for sustainable water management in their country. So this shows that many countries have sufficient policy on sustainable water management, but as you can see in the answers, there's also room for improvement. And in regards to the second question, most people answered that there are that people in their countries sometimes face challenges of water insecurity. And I think this shows really clearly, if you look at the results and also see that so many people answered yes, always, that still many people around the globe are facing water insecurity, and there's a need to improve drinking water supply around the globe in many countries. And on the last question, we have the results here, and I think this is really clear with the results. So in regards how long a hospital in a given country could deal with the water shortages, most people answered that it could only deal with this situation with under 2 to 6 hours. And I think this shows how badly prepared our hospitals, and especially, or in general, healthcare facilities are for water shortages. And yeah, also there's a need to improve. So thank you very much for the participation and giving us this opportunity to be part of this session. Thank you.
Thank you very much, Young Korea Group. And I think we are ahead of time. And as we conclude this session, I want to express my heartfelt appreciation to our keynote speakers, our dedicated panelists, and all the participants here, and the entire World Water Week community. So your contribution have illuminated the critical relation between the urban water and human well-being. Although we are kind of a little rushed in the timeline, the insight we shared here are urgent for the change. Let's carry this moment forward and make these sustainable urban water practices to be promoting our health, resilience, and always remember our actions have the power to shape the policies and transform the communities. So hereby, I would like to close our session. Thank you very much for all.
Thank you. The report of this session will be posted at the UNU-IS website in several days. Please go and take a look. Thank you.
Thank you very much.